Hi, good morning, Jones. My name is Mihiraa. Let's start the warm-up session. Do you have a role model?
Yes, I do. My role model is my mother. I follow many of the things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, organizing skills, a polite and humble manner, and a helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Your preparation time is over. You can now start your role play.
Hello, I'm Oliver Holmes, the nurse who will be looking after you today. Are you Mihiraa?
Oh, hello. Yes, I'm Mihiraa.
First, let me confirm what you're here for. I have you scheduled today for an electrocardiogram, or ECG for short.
Yes, an ECG.
Before I explain more, can I ask, have you ever had an ECG test done in the past?
No, I don't ever had one before.
Mihiraa, let me explain what this test actually does and why it is so helpful for your doctor. It might help to think of your heart as having its own tiny electrical system that makes it beat in a steady, organized way. An ECG is a very simple test that records that electrical activity. It picks up the natural signals that travel through your heart each time it beats, and it prints them out as a wavy line on a piece of paper. One of the main jobs of this test is to check your heart rhythm, making sure it is beating regularly and at the right speed. It also monitors how well blood is being supplied to your heart muscle, which is very important because the heart needs a steady flow of oxygen-rich blood to stay healthy. Now, the purpose of doing all this is to help the doctor spot anything that might need attention. The ECG can detect abnormalities like arrhythmias, which simply means a heartbeat that is too fast, too slow, or irregular. It can also help diagnose conditions such as a heart attack, sometimes even one that happened quietly in the past without you knowing. All of this information guides your doctor in deciding if you need further tests or what treatment would be best, so you receive the care that is exactly right for your heart.
Oh, I see. That sounds quite important. Does it need any special preparation?
That is a very good and important question, Mihiraa, and I am glad you asked. The good news is that there is really no big preparation needed at home for an ECG, so you do not need to worry about avoiding food or drink or changing your daily routine. However, there is one small but important thing to remember for the future. That is to avoid using any lotions, oils, or creams on your skin before the test. This is simply because they can create a slippery barrier that stops the small, sticky patches from making good contact with your skin, and we need that contact to get a clear reading. Now, let me walk you through what will happen when we go into the room together so you know exactly what to expect. I will give you a hospital gown and ask you to remove your clothing from the waist up, just to give us access to your chest area. You will have complete privacy to change, and you can keep your lower clothing on. Once you are comfortable on the bed, I will gently place several small sticky patches, which we call electrodes, onto your skin. They are placed on specific spots on your chest, your arms, and your legs. Please remember, these patches only sense the signals your heart naturally makes. They do not send any electricity into your body at all. The whole setup is very quick and clean, and I will be here with you the entire time.
Sticky patches. All right. And is it something that's going to hurt? I'm not very good with medical machines.
I can hear that worry in your voice, Mihiraa, and I want to reassure you fully. This is one of the gentlest tests we do, I promise. The procedure itself is completely painless. There are no needles involved, and the machine does not send any electricity into your body at all. The sticky patches only listen to the natural electrical signals your heart makes. Once the patches are on, the actual recording part is very quick and will be over in about 5 to 10 minutes. All you need to do during that time is lie back comfortably on the bed, relax your arms by your sides, and breathe completely normally. The most important thing is just to stay nice and still so we get a clear recording, but you do not have to do anything special at all. Now, I have explained what will happen, but I want to make sure you feel truly comfortable. Do you have any other questions I can answer for you?
I think I can manage being still for 10 minutes. So, when will I know if my heart's map is all right?
Mihiraa, here's what will happen with your results. The recording we get today will be available for a doctor to review within a few days. It's a detailed trace and needs a trained eye to interpret it carefully. A follow-up appointment will then be arranged for you, either with your regular GP or with the specialist cardiology team here at the hospital, so they can discuss the findings with you properly and explain what everything means. So you won't be left waiting for a letter with no explanation. You will have a face-to-face conversation. Now, to summarize everything we've talked about, so we're both clear, you are here for an ECG, which is a painless test that records your heart's electrical rhythm to check for any abnormalities. For you, there was no special preparation needed at home, apart from being aware of the lotion. And here we'll have you change into a gown and place the sticky electrodes on your chest and limbs. You'll simply lie still and breathe normally for a few minutes, and the results will be discussed with you in detail at a follow-up appointment with your GP or a cardiologist in a few days. So, knowing all of that, how are you feeling now? Are you ready to come with me for the test?
Thank you, Oliver, for explaining it all so patiently. I feel much calmer now. Yes, I'm ready now. Let's go and map my heart's electricity.
You are very welcome, Mihiraa. I'm glad you feel ready.